Kamath, at the outset, thank you, Primer, for giving me this opportunity to speak on this very, very interesting topic. So before I share my slides, briefly, I would like to say that everyone needs exercise, more so people with metabolic complications. And anyone who walks into your office, if he asks what kind of exercise should I do, or if you ask him or her what you're doing, you're most likely to get the answer, I walk 30 minutes or I walk 60 minutes. Do you do anything else? Maybe just a little bit of yoga here and there, but basically it's walking. So let's see now whether that is really sufficient in times to come. So I will share my screen now. Yes. So getting the exercise prescription right is what I'm going to talk about. And is walking really sufficient? So I would like to say here that walking is important, but is it sufficient? So I do not have any disclosures for this talk. However, I would like to acknowledge that some of my slides have been given to me personally by Dr. Sri Kumaran Nair, and I'm going to show some of them from Mayo Clinic. Well, all of us know, but I'm going to reiterate just so that you have a perfect idea of what an ideal prescription for exercise should actually look like. You have here aerobic exercise, and in this you have repeated and continuous movements of large muscle groups, and this is where your walking features. So you can see here that this first part of aerobic, which is there, walking features here. But what you're missing out on if you do only walking are these two very important parameters. And these are resistance training and flexibility and balance. Now, resistance training basically prevents sarcopenia, and you do that with the help of free weights, weight machines, or your own body weight for that matter, or you use elastic resistance bands. It can be done in various ways. And as you can see here, you don't really have to hit the gym. You can do it on your own. And the third category is flexibility and balance, which is extremely important because it improves the range of motion around joints and benefits gait and prevents falls. So as time goes by, as we get older and older, these issues become very, very important, and they should be included in the exercise right from the beginning. And yoga and Tai Chi are good examples of both flexibility and balance, which can be offered by this type of exercise. So basically, in a nutshell, these are the three types of physical activity, and walking covers only the aerobic part and not the other two, which I have shown you over here. And this is the hierarchy of different exercises if you wish to burn fat, and that is what we all want. We want our muscle mass to stay where it is or improve if possible, and we want fat to go away. So if you had to do that, these different exercises that you see here, in terms of intensity and time required, you can see that they are actually inversely proportional. And walking features somewhere over here. So you require a lot of walking, okay, to get fat loss, and that may not be possible. And you can see that resistance training is right here in the center, and you have circuit training, which I'm also going to refer to a little later, which is right here at the bottom, which means that it is high intensity, no doubt, but very little time is required. And today we all know that time is at a premium, and that is why you will get different kinds of patients who say they don't have the time to do much of exercise, because if they had to burn fat with walking, they would have to do a whole lot of it. So this is how it is spread out in terms of fat burning for as an exercise. So clearly, why walking is not sufficient, it is not sufficient, is what I'm going to tell you in the next couple of slides. But to know that why walking is not sufficient, you need to know a little about the effects of aging. What happens once you start aging? You get sarcopenia. I know you've heard about sarcopenia in one of the lectures just before this, but basically it involves all the striated muscles, including the respiratory muscles, and is the main cause of fragility and dependence on others as time goes by, and is responsible for falls and fractures. And it has nutritional implications, and it is associated with a whole lot of metabolic problems. So that is why we have to tackle sarcopenia, and clearly just walking is not going to tackle sarcopenia. And just to reiterate further, this is an excellent study done in the Mayo Clinic itself, where this is thigh muscle area and this is the knee extensor strength. And you can see here that as a person ages, you can see that the muscle mass keeps on reducing both for men and women in both these muscle groups studied. So this is a very important study to tell us that as you age, your muscle mass is going to get compromised, and you have to try and limit that to whatever extent possible with the right kind of exercise. So just to show you pictorially, this is the picture, the skeletal muscle mass of a young person versus that of an old person. Look at what has happened to the muscle mass. So this is how it reduces, and this is how you transition from being young to being old in terms of skeletal muscle mass. And when this happens, what you're going to have is reduced muscle mass, reduced muscle strength, number of muscle fibers are going to reduce, etc., etc., and muscle protein synthesis itself is going to be much less, and hence the mitochondrial function. And this is what is responsible for the various metabolic problems that can come about. So you can see here that this is, if you want to prevent the transition from here to here to whatever extent is possible, then clearly walking is not sufficient. You need to get these muscles in place. You need to limit the sarcopenia. You need to limit this entire process that you are seeing up here on the screen. And for that, you require a good regimen or a good exercise prescription that clearly does not have only walking. It has much more. And therein lies the importance of resistance training. So along with walking, resistance training is also very important. And how does that work? What resistance training does is it causes microscopic damage or tears to the muscle cells, which then are quickly repaired by the body to help the muscles regenerate and in the process grow stronger. So you actually damage it and then make it grow. The muscles heal once you have done that. Once you've done one bout of resistance training and you have caused this microscopic damage, then the muscles begin to heal and they begin to grow between the workouts, not at the time that you're doing the resistance training, but between the workouts it is given. And that is why you need a period of recovery. We always say do not do resistance training for the same groups of muscles on 2 consecutive days, because this is the basis that you need time for the muscles to grow. So you have to give a day's at least 24 hours in between. This is a study that tells you about resistance training in type 2 diabetes in older adults. Why have I picked this study? It is because everyone says that we are quite old. Can we really do resistance training at this point of time? So this is a study which tells us very nicely. It's a randomized controlled trial examining the effects of progressive resistance training on insulin resistance and body composition in older adults. There were 103 participants, and they either received resistance training or sham exercise 3 days a week for a whole year. And HOMA2IR and A1C were used as indices of insulin resistance and glucose homeostasis. And skeletal muscle mass and total fat mass were assessed using bioelectrical impedance. Visceral adipose tissue, mid-thigh cross-sectional area, and mid-thigh muscle attenuation were quantified using CT. So this was a study done a few years back. And these were the changes. So if you can see here, the group that increased their skeletal muscle mass had reduced insulin resistance and also reduction in A1C, as you can see, as opposed to those who did decrease their skeletal muscle mass. And on the other hand, those who decreased their visceral adipose tissue also had a reduction in HOMA-IR and also a reduction in the A1C. So you can very clearly see that over a period of 1 year, in these patients who are older adults with type 2 diabetes, resistance training even at that point of time could reduce their insulin resistance and reduce their A1C with better glycemic control. So the conclusions of this study were that improvements in metabolic health in older adults with type 2 diabetes were mediated through improvements in body composition, and they had to do high intensity under supervision resistance training. So what it clearly means is that it is never too late to start, and resistance training is an important part of the exercise regimen in order that metabolic control, glycemic control, weight, and sarcopenia are all dealt with this particular kind of exercise. So it's very, very important. Now you will also realize that a lot of people don't have a whole lot of time to do so many things, and yet they wish to burn fat. So this is the newest kid on the block. It has been there. And as I showed you in my very first slide, I talked to you about circuit training, which was right at the bottom of the pyramid. So it was high intensity, but takes the least amount of time and gives you benefit in terms of fat burning, which is important because then in relation to that, the muscle mass is more and you're dealing with sarcopenia as well. So this is high intensity interval training that is talked about nowadays. So basically, what is this? This is commonly called HIIT, high intensity interval training. Simply meant it is repeated bouts of high intensity effort followed by varied recovery times. So the simple mantra of HIIT is you train harder, that means high intensity, but train briefer, that means you do it for less amount of time. So as I said, one size does not fit all, even in terms of exercise. You have different people with different occupations and different time constraints. And therefore, you can definitely use this in the appropriate patient. And this works on the basis that the epoch, I'm going to show you what the epoch is. It seems to be higher for HIIT. So basically, the post-exercise period is called epoch, which stands for excess post-exercise oxygen consumption, and it is generally about a 2-hour period after an exercise bout, not during. People keep on counting the calories that they've lost when they are on the treadmill. That's not the real picture. I lost 200 calories and I lost this. So it's not that. What is important is that the period after an exercise bout, where the body is restoring itself to pre-exercise level, at that time it is using more energy. So that is very important. That is excess post-exercise oxygen consumption. And what has been found is that HIIT workouts tend to burn more calories than traditional workouts, especially after the workout. And it could be 6 to 15% more calories that are burnt when you do an HIIT bout. So that is the importance of doing this. You get more for less. This is a study which again talks about the effects of HIIT on muscle size and quality in overweight and obese adults. And this study concluded that it may be an effective exercise modality to influence muscle size in overweight and obese individuals. Of course, future studies are required. And this is another study in patients with metabolic syndrome. And they've looked at HIIT and the cardiac autonomic control in individuals with metabolic syndrome, because this has not been studied in the past. Every other parameter has been studied, but probably not cardiac autonomic function. So they aim to find out whether HIIT had any impact on that. And what did they find? They found that though there was no significant between group differences, but the greatest magnitude of effect for improving cardiac autonomic function was in individuals with the metabolic syndrome. And that's what we want. So it's something to consider. So there are various parameters that are being affected. As I said, it burns more calories in the post-exercise period. And this is another study to show you about the cardiac autonomic function. And it can be done in various ways. In fact, look at all these different kinds of exercise. Any one of them, you can apply HIIT to that. So it's not a particular type of exercise. You could be doing any exercise and you could convert it into HIIT by having intense bouts followed by periods of recovery. So it can be done in very many different ways. So your resistance exercise can turn into an HIIT, your aerobic can turn into an HIIT, and you could be burning more fat by doing this particular thing. And this is just to tell you that these are so many different ways in which you can adopt HIIT. There is no fixed rule for that, and you can gradually work up and go up. So, but you have to be careful, because people who have been very sedentary for a very long time may have increased coronary. If they suddenly start to do it, you could have a problem. Family history, cigarette smoking, hypertension, diabetes, all of these, you have to be a little careful. And medical clearance from a physician is better before you embark on HIIT. And the other important thing to understand is that it should be done very slowly. That means your HIIT periods should be short in the beginning. Your recovery time should be more, and then you can gradually start to build up. So it is very customized, and it should be under a good trainer who understands your body. This is going to be my concluding slide, but my most important slide, where I'm telling you that the ADA 2021 guidelines, though it's meant for diabetes, it holds true for everybody, not just people who have diabetes. So what it says is that most adults with diabetes should engage in 150 minutes or more of moderate to vigorous intensity activity weekly, spread over at least 3 days per week, and shorter durations. You can imagine how much HIIT has caught on and how the evidence is for that, because here it talks about HIIT that may be sufficient for younger and more physically fit individuals, and that may be all that is required. And the most important is the one in the middle panel, which says that adults with diabetes, and for that matter, anybody and also people with metabolic syndrome, should engage in 2 to 3 sessions per week of resistance exercise on non-consecutive days. So this is the most important thing. The takeaway from my talk today is that walking is good, but it is not sufficient. What else should you be doing? If you have time only for one other thing, then it should be resistance exercise. And of course, in older adults especially, flexibility training and balance training are recommended 2 to 3 times per week. And yoga and Tai Chi combine both flexibility training and balance training. And they're very important so that it increases the muscular strength, prevents falls, prevents frailty, and prevents dependence. So that is the important thing. And not to forget, you could that entire day physical activity, that is non-exercise physical activity that we talk about, is extremely important, which I'm showing you here in my last panel. And the reason for this is that if you just exercise one bout in the morning, you finish your HIIT and your resistance training and your walk, and then whole day you are just going to be sitting down, then that is not going to be useful. In fact, it's not going to give you much benefit. So if you want the benefits of all that you did in that morning bout, then you must be active in a small way in your daily activities as well. That is incidental exercise, or rather non-exercise physical activity, to gain additional health benefits. So let me conclude by saying here that aerobic exercise is for all. It increases stamina, it increases cardiorespiratory fitness, but that is not all. Unfortunately or fortunately, we are not hunter-gatherers. So all our body muscles are not exercised in the way that hunter-gatherers did in the past. So we have to do different kinds of exercise to achieve that level of fitness and that level of health. And that is why a combination of all these exercise is a must for overall total general health and metabolic health as well. So thank you all for your kind attention.
Thank you, Dr. Neeta. It was an excellent talk. I think very less talked or less what we see in our practice. You've really given a good overall view of the different exercises and how much to do and how much is the limitations in addition to the regular walking what we do. Dr. Sheshadri, do we have time for the questions?
Yes, we have.
Yes,
time.
sir. 5 minutes.
Okay. So I think Dr. Shankar wanted to ask some question.
So you're muted, Dr. Shankar, you're muted.
Yeah, can you hear me?
Yes.
Yeah, there is excellent presentation about this sarcopenia. So in elderly patients, especially more than 50 or 40, fourth decade or fifth decade with a gross sarcopenia, are you going to do muscle biopsy to rule out any congenital myopathies or chronic degenerating diseases, or straight away you would depend only on the diabetes and then treating the patient?
I think from the diabetes perspective, sir, obviously, as we said,
increasing age.
There are so many things. Many times it will all associated with the diseases.
Correct. So I think, as I've shown in most of the associated trials, that the duration of diabetes and basically diabetes per se increases the risk of sarcopenia. So I think we should probably start with that. And obviously, if basically there is a little bit of a difference in terms of neurological examination, like if you have some motor neuron disease kind of things, fasciculations, some certain bulbar palsy kind of aspects, that's when you look at other aspects. But I think simple things first. I would think that diabetes and sarcopenia are both related to each other, so we should start with that.
Thank you, Dr.
Question to Dr. Neeta.
Yes.
So is there any absolute contraindications for this resistant exercises in our diabetic patients, particularly if they have some complications like nephropathy?
So they have bad, retinopathy, and if they have, uncontrolled hypertension, then these are the people, or if they have a very strong family history of coronary artery disease and they have not been checked out, then these are people, I would say they're relative contraindications. They need to be looked into, they need to be treated for this, and then they should be taken up, and in a small way. So resistance exercises can be done even in a small way, even that will have benefit. So one need not, there are gradations in that, and a good trainer will be able to build it up slowly, even in such kind of patients.
Thank you.
Dr. Neeta, for children, if they do heavy exercises, say for example, normally we suggest 45 minutes per day or 150 minutes per week, like that we suggest for adult. For a type 1 dependent on insulin, if they do heavy exercise, their blood level usually varies. Normally they will go for an hyperglycemia. What could be the cause for it?
Well, they need to, first of all, do a lot of SMBG to find out what their sugars are being like when they're undertaking this kind of exercise, and it should be under supervision. And they can get hypoglycemia during such events. There can be a correctional hyperglycemia because of that as well. So there can be a lot of fluctuations leading to severe hyperglycemia also. It's not just hypo we are worried about, it's also a compensatory hyperglycemia. So it's a wise thing for them to, before embarking on this kind of exercise, to do pre and post and during. They need to know their body first, and then embark on this kind of exercise.
Thank you, Dr. Neeta.
If there are no other questions, I would thank the chairpersons, Dr. Shankar and Dr. Dinesh V. Kamath, for their time and their inputs. Then we had Anand Kumar Annamalai. Thank you very much for this talk on sarcopenia. And Chitra telling us it's always better to ask patients if they're okay, and it's also okay not to be okay. That's the new statement. Please agree from